I want to bring in New Mexico's House Speaker, Democratic State Representative Javier Martinez. Representative, thanks for joining us. Your state is able to cover these subsidies in full for now. Can you walk us through that plan, and how long are those funds going to last?
Yeah, thank you for having me. Great question. Look, New Mexico, we have far planned to make the Affordable Care Act better for our communities. Back in 2021, we created something called the Healthcare Affordability Fund, which is funded through a surtax on private insurance premiums. That fund has over $100 million. And over the last several years, New Mexico has actually had a state level subsidy to go with the federal subsidy and to include coverage for all kinds of communities here in New Mexico, including our immigrant community. New Mexico is really looking forward on this. Now, with the lack of action from Congress and with the cruelty coming down from Trump and Johnson in the Congress, New Mexico has stepped up to cover in full those federal subsidies this calendar year and into next calendar year. And we are prepared to do what we have to do to make sure we keep healthcare affordable for our people. Having said that, we can't do this forever. No state can do this forever. And so we are looking forward to the Congress taking this up and doing the right thing.
Are you worried at all, Representative, though, that Congress, that Republicans, that the president could see what your state is doing and what a few others may do and decide this is left to local governments, that local government should fund this instead of the federal government?
Well, look, there's only a few states, as you mentioned at the opening, that are doing this. And as far as I know, we're the only state fully covering the subsidy for all of those at 400% of the poverty line and below, for whom here in New Mexico means $120,000 for a family of four. Most states are not going to be able to do this. And a lot of those states have moderate Republican seats right now. And if they don't get their act together, the people of those districts will give those folks their pink slips and replace them with good Democrats who are going to do right by those working families.
There are a lot of plans circulating, as you know, in Congress for a potential bipartisan proposal on this. Some Republicans are pushing health savings accounts. The president has also pushed that. Do you think that would be a fix here, or would it hurt people with pre-existing conditions?
I think it hurts people with pre-existing conditions. And I think, you know, all of these sort of quasi-privatized fictions that these guys come up with, if they're not rooted in reality, if they're not rooted in the needs of working families, if they don't stabilize the entire healthcare industry, they're not going to work. Obamacare works. It's worked for millions of people over the course of the last 10 or so years. All they've got to do is do the right thing and extend these subsidies so that people in my state and in states across the country can afford their health care. Children with cancer, seniors with terminal illness, folks with chronic conditions. The cruelty of this administration knows no bounds, and Johnson has to grow a backbone. He has to grow a backbone. He's a Speaker of the House of the United States Congress. Look, I'm not comparing myself to him. I know how hard it is to be Speaker. Grow a backbone, Mike Johnson. Do right by the people of your state and of the country.
What are you hearing from your own constituents? Do some of them like the idea of a health savings account, or do they want to see these subsidies cleanly extended?
For my constituents in my district and for people across the state of New Mexico, where I travel all the time in this role, I hear that Obamacare is working for them. No question about it. Now, do we need to get a hold of the skyrocketing insurance costs? Of course. That's why I would advocate for a single payer system, Medicare for all. That's what we need to ensure all of us can get affordable health care. But short of that, Obamacare works. There is not one person in my district, there's not one constituent who will fall for this health savings account fiction that Trump and the Republicans are trying to push.
New Mexico State Representative Javier Martinez, thank you.